Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Patient safety organizations, or PSOs, improve patient safety and quality through the reduction of adverse events. Here to talk about that effort is my colleague, Kathryn Merkeley, Program Director with the Vizient PSO. I'm Gretchen Brummel, Pharmacy Executive Director with the Vizient Center for Pharmacy Practice Excellence, and your program host. Welcome, Katie.
Thank you. I'm excited to be here.
Tell me a little bit about your background before coming to Vizient.
I'm a nurse by background. I was an ER nurse in pediatrics, adults, community, urban hospitals. So a diverse background, a little bit of a trauma junkie. I worked in pre-hospital before I went to nursing school. But I always knew that I would step away from the bedside and I wanted to learn more about how hospitals and healthcare organizations function. So my first step was as a ER nurse educator and then an ER nurse manager. And then I'm coming to Vizient from my last position, which was the Director of Patient Safety for a large academic pediatric hospital and health system. So overseeing both their main campus hospital and then the ambulatory sites and other parts of the system.
Very robust background. What is a PSO and how do they really function?
PSOs were created under the Patient Safety and Quality Improvement Act of 2005 with the goal of supporting and accelerating patient safety and healthcare quality improvement. Before the Patient Safety Act, providers were really concerned that information that they shared about safety events or improvement processes could be used against them in litigation. That really inhibited how information was shared within health systems and across providers. And when we say providers, that's a term that our Agency for Healthcare Research and Quality uses to describe participants in a PSO. And it's really a broad term in that a provider could be a large-scale health system or it can be a single individual provider clinic. PSOs really help by removing the barriers, giving federal privilege and confidentiality protections to the information that's voluntarily reported by providers to the PSO for the purpose of improving patient safety, quality, and outcomes.
What are some of the benefits of membership to organizations?
The benefits for providers of working with a PSO is the federal privilege and confidentiality protections on a national level, but really supporting safe spaces for learning and improvement. PSOs are able to aggregate data and identify patterns or trends for what are usually infrequent, but oftentimes tragic adverse events faster than an individual provider would be able to analyze and be able to look at that data. Data is collected by PSOs in a standardized manner, and that really allows us to provide meaningful comparison across similar providers. And then lastly, PSOs really create a learning community, and that's where providers can share information and lessons learned and really to support each other and accelerate each other's improvement efforts.
How common is it for organizations to belong to a PSO?
Working with a PSO is voluntary. However, most providers choose to participate in a PSO for the federal protections and then the collaboration and learning. Under the Affordable Care Act, though, hospitals with more than 50 beds who participate in the insurance exchange must work with a PSO or comparable organization for generating quality improvement. Our Vizient PSO has over 400 members, and they're across 37 states. We really have a wide range of provider types from large-scale health systems to single providers, ambulatory clinics, and pre-hospital medical services, which really brings a diverse perspective and expertise to our membership in collaboration with each other.
What's the return on investment for health system leaders for belonging to a PSO?
Participating in a PSO really supports a just culture and creates a safe space for healthcare workers to speak up and share their concerns. And by doing so and making safety concerns more visible, leaders are able to step in and promote proactive risk mitigation before harm ever occurs. By promoting sharing of leading practices, providers can benefit from the knowledge and lessons learned from others. No one's reinventing the wheel. They're able to take what has worked for someone else and apply it in their own improvement journey. And then quantifying safety events that did not occur is really hard to do. But at Vizient, we're trying to do so. We have a mislabeled specimen value metric, and we provide every one of our providers with information on the cost of their mislabeled specimens and then evidence-based improvement recommendations to help them address that cost in the best way we can quantify it.
I love that concept of the shared learning of belonging to a PSO. How can a PSO support specifically medication safety efforts?
Because our PSO analyzes large volumes of data from a wide range of providers, we're really able to pull out those sometimes really hard to find or really quiet signals or trends within the data on medication safety. And so one example of that is a recent project on pediatric procedural sedation. And so with that, we're working with subject matter experts to create leading practice recommendations for safe care delivery in pediatric sedation. While doing this, we were looking at our data and we identified that pulling the wrong medication on an override was a very common error related to sedation. So we were able to partner with our pharmacy team at Vizient and our group of subject matter experts on our advisory committee to provide targeted recommendations for preventing this type of error before it even occurs.
What a great success story. Tell me a little bit about how you standardize your approach with having multiple members to your PSO.
The Agency for Healthcare Research and Quality provides common formats by which providers submit events to PSOs. And this provides a standardized approach to reporting and then really supports valid comparison across provider types. But the Vizient PSO also has a proprietary event taxonomy, and that was developed by our providers, and it incorporates the common formats as well as providing a common classification for event types and subcategories. And the common formats in Vizient taxonomy gives our providers a common language to communicate about safety events that are happening in their area. We also have a standard suite of services. So we have a yearly calendar of webinars and other offerings, and those are based on topics that our members bring to us that they would like to learn more about or challenges that they're facing. We also provide an annual feedback report to our members, and that's a standardized analysis of the data submitted to the PSO, but also some individual and targeted recommendations for some of those key trends that come out in analyzing that provider-specific data.
I can see all those pieces being very helpful for standardization. Where do you see things going in the future?
Patient Safety Act really has two goals. One is to create a culture of safety that supports learning and improvement through sharing of safety events, but the other is to create an environment of accountability. Our belief with the Vizient PSO is that healthcare leaders really can design organizations in a way that creates an open and honest environment of communication between providers, patients, and families, but also create a safe space where providers can learn and improve. Our work now and in the future is based on this belief, and our role is to create opportunities and resources that really make it easy for leaders to create this culture of safety and environment of accountability.
Some exciting opportunities for the future, indeed. So how can some of our frontline pharmacy staff get involved in the PSO, or how are they impacted?
They can join our colleague connection meetings, and that's where they can share their expertise or learn from others. Medication safety has a broad impact on patient safety, so input from pharmacy staff is an integral part of any conversation when we talk about patient safety. Taking part in an advisory committee and be part of designing resources for our providers. We have a pharmacy and PSO listserv where pharmacy staff can share information or ask for feedback from other providers 24/7. And they can attend webinars or other offerings to learn how to support the culture of safety and accountability within their own departments and teams.
All great resources. Thank you so much for sharing. Katie, thank you so much for joining us today to share your perspective. I'm so glad you could be here.
Thank you so much for the opportunity.
Please join us for more Verified RX podcasts. Subscribe today, like us, and send us your comments. We'd love to hear from you. Verified RX is your prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. I'm Gretchen Brummel. Thanks for listening.